The discus medications, like all of the DPIs, require an appropriate inspiratory force and patient effort. Therefore, they should be inhaled with a quick, deep breath to deliver the medication appropriately to the lungs. Let's watch as Casey describes and demonstrates how to use the discus to Mrs. Ryan.
Hello, Mrs. Ryan. I'm Casey.
Hi.
I'm here today to show you how to use a new inhaler device.
Great.
This one's called a discus. Now, the discus device has 2 different medications that come in it, but are 3 different inhaler devices. And you'll know which one your clinician prescribes because they're each a different color.
Oh, okay.
Now, if you have an orange one, it has fluticasone in it, which is an inhaled steroid. If you have a green one, it has salmeterol in it, and that's a long-acting bronchodilator that opens up your airways for 12 hours. The last one is a device that has both of those medications combined, fluticasone and salmeterol, and it'll be purple. So your clinician will tell you which one they'll prescribe, and you'll get a different color depending on what they prescribe.
I see.
So now let me show you how to use the discus device. The discus device is an easy one to use. You take and hold with your left hand. There. Now you use that indentation for your right thumb. You push it away from you till it clicks. Now here's your mouthpiece. You now need to load the medication into the device. So you take the lever here on the right and you push it away from you till it clicks. That's now loaded the medication. So since it's loaded the medication, you don't want to be shaking it or else you'll lose the medication. So since it has a dry white powder in it, you don't want to be breathing into the device or exhaling in there. That'll just gum up the medication.
Right.
So you want to breathe away. Now you put your mouth and lips all the way around this. Sharp, deep inhalation and hold your breath for 10 seconds. And usually I say, hold it like a hamburger or a cheeseburger, and that's an easy way to remember to keep the device just the direction it needs to be.
Right.
Now, if you need to, you can wipe off the mouthpiece with a dry cloth. You shouldn't put it in water because it has white powder in it. Lastly, you close it up by taking your thumb, putting in that thumb cock, close it all the way up till it clicks.
Easy.
Now, on top, it has a dose counter. It goes down in individual doses. It's a little bit difficult to see because it's small print, but the last 5 doses, so the last 5 are going to be in red, so you know it's getting to the end.
Oh, good.
And then once it's down to 0, obviously time for a new one.
Okay.
Now, if this has fluticasone in it, so if you have the purple or the orange inhaler, you need to rinse your mouth out. So you rinse your mouth out with water, so you rinse and spit. Make sure you don't swallow the water. That gets the steroid off your tongue in the back of the throat.
Okay.
So now I'll have you do a demonstration for me.
Oh, okay. Put my thumb here, push this away. And then I'm going to load the med.
Good.
Is that okay?
Excellent. Excellent.
Okay, and then I'm going to close it back up.
Perfect.
That's one less.
Yes. Any questions?
I don't think so. Thanks, Casey.
You're welcome.